Darren had a smile that would literally melt your heart. He's my absolute favorite person in the world. He was generous and giving and very selfless. Definitely a gift to this world and me. When I think back, he started exhibiting signs since he was a child. He would hurt himself and claim that it was an accident. I didn't realize it was self-inflicting wounds until it was too late. His cries for help started getting louder and louder as he gets older. I called my husband and told him about the text exchange. He then called suicide prevention. He was made to go to the hospital. Insurance only keeps them for 7 days. After that, they let them go, whether they're okay or not. Friday, I picked him up against my will. Saturday, he was adamant about going back to his home in Bloomfield. I texted him, telling him I'm on my way. He didn't respond. I called him, he didn't answer. When I opened the door, I found my baby hanging off of a chair.
It started when I was younger, around the age of 5. I didn't know what it was. I was extremely sad all the time. My grandmother was murdered at the age of 25 by her husband. He stabbed her in the heart. My mother's foster mom, she mistreated my mom most of her life. So when my mom became of age, my mom left where she met my dad. He used to beat my mother up just about every day. So she jumped out of one bad situation into another one. I don't understand taking my brother away from me. I think a lot of it has to do with my dad beating my mother up during her pregnancy. I decided to go seek help the second year in my marriage. And I went for a short time because I don't like talking to people because I don't know how to explain myself. And trying to explain myself to people, it makes me feel dumb. I have a hard time processing certain things. I couldn't process therapy. I get depressed. I don't even want to wake up. But I think about my kids. I remember that and I just push through. I try not to get my son upset because he goes through depression too and refuse to seek help. And he so desperately needs it.
No one asks to have a diagnosis of a mental illness. It's caused by many, many different factors. Some environmental, some historical, some chemical. The number one reason why people in a mental health crisis or needing mental health services do not seek help is because of stigma, because they don't want to be judged. They're ashamed. They don't want people to discriminate against them. I need you to be mental health warriors. I need you to fight stigma. I have been encouraging people to try to eliminate from the vocabulary, one word is the C word, crazy. You marginalize the individual by using those type of derogatory, discriminatory terms. The Health and Human Services Office of Minority Health reports that Black adults in the United States are more likely than white adults to report symptoms of emotional distress, such as sadness, hopelessness, and feelings that everything is an effort. Well, the mental health struggles that are specific to the Black community have to do with daily trauma and the historic legacy of trauma, issues of implicit bias, and systematic racism that continues to exist. There are trust issues because of medical experimentations that have taken place in the African American community, so it's hard to trust science and medicine are adequate, fair, and safe for this population. NAMI New Jersey recognizes that different cultures approach having a diagnosis of mental illness in a different way. 32 laps. The Act Now program emphasizes the experience of African Americans who may have a diagnosis of a mental illness or giving support to a family member around that diagnosis.
One of the things I was doing, just looking at organizations actually doing impactful work. And mental health happened to be the one to come out from the global pandemic. So I was also looking for ways to, again, show support, also spread the word, and just normalize the conversation. Sometimes it's certain habits that you need to stop to get you in the right frame of mind. Sometimes you need to talk to somebody. So for me, I just wanted to show that support, be engaged with an organization that's really going into the grassroots of the community in the state of New Jersey. To have these conversations, to provide resources, and just connect people with the resources that they need.
NAMI's mission to help families and individuals affected by mental illness through education, advocacy, and support is one of the reasons I am happy to be a partner of the organization and to be here in front of you today.
NAMI was one of those organizations doing that. So that's how we got talking with the leadership and found ways to kind of get connected and see what we can do together. And realizing it's more than just giving people a phone call, having people call a hotline. It's paying attention. And we all have a role to play in reaching out to one another.
He told me to take the money that I spend on him and open a business that will help thousands of people and that would make him happy. And that's why I established this foundation, because the hopes is to help many others and prevent parents from feeling this pain and to let the youth know that there is help and there's hope for them. There's someone out there who does understand them, and there's other people who are going through what they're going through.
This is not normal sad. That period in my life was just so dark. There was months of just tragic events. My cousin, who was staying with us at the time, she ended up passing away in the house. We found her the next morning. A week after that, Darren passed. We had plans, I was on my way to his house, and by the time I got there, he was gone. Not too long after that, found out that yet another one of my friends had passed. It was too much. I called my grandma and I was listen, I can't do this anymore. I just felt so broken down and defeated and powerless. My grandma kind of really saved my life because unbeknownst to me, she was communicating with my mom. I love you. I did get my official diagnosis with anxiety, depression, and bipolar. I've gotten paired with doctors and therapists. I've been put on medication. I want people to know that there are resources, coping mechanisms. I still definitely like go through my periods, and they can really last. There's plenty of days during the week that I wake up and I don't want to die, and I am excited for, like what the day has to hold. I didn't think that I would ever get there, but here I am.
My children both have been hospitalized a number of times for attempted suicides, as well as just their mind state. When Deirdre found out that I had two children, one with bipolar disorder and anxiety and depression, and then my daughter has anxiety and depression, she was there to try to get us therapists, psychologists, any kind of appointments, whatever help we needed, she was there. Anyone who is willing to help me, I'm willing to help them. We don't want anyone to end up like Darren. So whatever type of help we can give to communities, especially in the Black and brown communities, we will definitely do.
We educate the people on what mental illness is, and we actually show them and give them the resources that are available. I had no inkling on half of the resources that were there. We had resources that were right up the street from me, and I had no idea. My goal is to make them aware of what is out there. When I first started Invisible Pain Day, it was just a vision that I had. Let us keep our candles lit and take a moment of silence to honor our loved ones who are no longer with us. And I went to NAMI, New Jersey, and asked them if they will co-sponsor it with me. We just made this day happen.